Perfect. There is live transcription available as well for this. So my name is Brooke Snyder. I work on the direct care workforce team here at HCBS. I'm here with my coworkers, Jennifer Blair and Sam Hall. And today we're going to be doing just an application walkthrough for you for the HCBS Provider Training Grant, which is ARPA 1.05. So just a few housekeeping items. We are recording again, so you have the option to revert back to the recording for review or for questions. We aren't able to share the slides today, but you're welcome to review the recording as many times as you'd like. For any questions you have, we're going to ask that you email the team, and we'll drop the email in the chat several times throughout this. The reason we ask that is that Sam, Jennifer, and I are not on this project. We are as far removed from this project as we possibly could be, actually. Because there is a grant review cycle for these grant applications coming in, our team has been split, and half of the team may be on that grant review committee. And so they want to make sure there's no conflict of interest with folks that are reviewing the grants and us that are doing the application today. So we can do a walkthrough. We have prescribed slides that we're going to share with you, but in terms of answering questions, we just do not have, you don't want us answering your questions. We don't have the answers or the capability to do so. So we are going to ask that you go through that HCPUF_DCW workforce at stateco.us because those questions go through the correct people. And with those questions being sent to that email address, they are posted to our frequently asked questions and uploaded onto the website for other folks. So Sam will be providing the email. I see she dropped that in there. So we're just here to read what we have on slides for you. Meeting materials will be uploaded to the ARPA grant website, which we'll share here in just a second. That'll be the recording of this, and also bookmark that for those frequently asked questions that are updated all the time. If you're listening by phone, you are welcome to press *6 to unmute your line or *9 to raise your hand. And we are providing closed captioning, which you should have the option to turn on from your black bar at the bottom of your screen. Information about our team can be found by searching the Direct Care Workforce Collaborative, or we can provide that website in there, perfect. Sam's on it. She's dropping all kinds of stuff for us. So with that, I'm going to go ahead and get us started on where do I start? And so I'm going to go over this briefly, and then I'm going to let Jennifer share her screen so you can actually see the website where this information can be found. So the first thing we're asking you to do is start on the ARPA 1.05 training grant website. And so I'm going to go ahead and quit sharing and let Jennifer share hers.
I think I'm unable to.
Oh, well, that's
Host disabled participant from screen sharing. Sorry,
right.
Brooke.
That's okay. I made you a co-host, so you should be able to do so now.
Let's try now. Are you able to see it now? Is that? No. Any luck with that one?
That looks good, Jennifer. Thank you. I was muted and I was just talking away. Perfect. So if that's on your bingo card that somebody was muted in an online meeting, go ahead and check that off for us. So when you click the link that Sam had put into the chat, this is the 1.05 Training Fund Provider Grant webpage that you'll see. And so on this, you'll see a summary of the project, the request for application or the RFA, how to apply, materials you'll need, due dates, and award announcement dates. So summary of the project is going to show you and give you a little bit of background information on this fund and its purpose. It can be helpful and will kind of allow you to start seeing other ARPA projects that we have. So it links to the Direct Care Workforce Collaborative, where stakeholder engagement opportunities can be found. It'll list other trainings funded from this fund that might be of interest, and also information on how to apply for the grant. So that's what you'll find there on the summary of project part of that website. The request for application or the RFA gives you a little background and all the questions that will be on the actual application. So this is a great way to prepare for the actual application. You can start formulating your answers to the questions before you actually open the application link, and you can copy and paste into the application fields what you formulated. We're going to go through specific questions on the application and then the budget worksheet. In just a few minutes, we have screenshots and ways to look at that. But the request for application will also give you the link to the budget workbook that you'll need to complete, as well as other necessary documents. There's some information at the end that talks about what will occur if you are awarded a grant. We'll talk about that here in this webinar. And there'll be a pre and post survey that is required, as well as monthly updates and invoices. So all that can be found in the request for application. Going down the screen there, you'll see materials. This will give you the link to the budget workbook. It's linked in various different places, and we'll have you download a copy to work on that. And again, we'll go through that later in the webinar here. There's a link to a W-9 form, the frequently asked questions, which we've mentioned before. Again, it's linked in several different spots, but if you continuously go back to this website, that's where you're going to find the most updated information, the most updated frequently asked questions. And we usually badge it with new once those have been updated. And if your question is actually selected, or if you email in and your question is put on the frequently asked questions, you'll receive a response from our workforce team that, hey, your question's been answered, please review. And then again, the RFA that we keep talking about as well. Deeper dive into the frequently asked questions. Jennifer, I'm going to go ahead and have you quit sharing, and I'm going to come back to you and share my screen again so we can go through the rest of this information. Thanks for letting us toggle back and forth. We thought the view of the website would be helpful for folks. All right, let me switch that. There we go. All right, so deeper dive into frequently asked questions. What are the limitations of the grant? Sometimes it's easier to start with what cannot be considered. So the thing you'll hear us say the most is that we're supplementing, not supplanting existing training required. Sorry, I lost my screen there. That was interesting. Supplementing, not supplanting existing training required. It cannot be used to provide things that you're already providing, your onboarding, your required trainings, stuff that you're already doing on a day-to-day basis. That's not what we're looking to pay for. We're trying to go above and beyond that. So training expenses incurred prior to the grant approval notification. So we're looking at things moving forward. So we've had a few questions that are like, you know, we started doing this training in July. Are we able to apply and go back to that July date for reimbursement? No, we have to award the grant first before we can move forward to help pay for training expenses. And then we have a slide up next that's all the ineligible activities. These items are also listed on the FAQ. So sometimes if you already had started a new training and you'd like to use the grant funds to take over, that's going to impact the score of your grant. So how this works is there's actually scores for each question, each part of the grant. And so that's how it's going to impact your score. It's just going to say, well, maybe it's not going to be that high of a score because these are things that are already happening. And so ineligible activities and items include, in addition to those things that are already being paid for. And I apologize, this is very small print, but there's a lot. We understand this is a training grant and there are lots of things that go into training. However, just a lot of restrictions that we have to consider with this grant. So we want to be upfront about that. Capital equipment is non-expendable tangible property. Think audiovisual equipment, fences, vehicle, furniture. That's obviously not an inclusive list, but those are the kind of things that we're talking about there. Computers and associated equipment. Printers, anything that plugs into Bluetooth USBs to your computer is considered computers and associated equipment. Training related audio and visual equipment, projectors, speakers, microphones, standard core curriculum development. So this is just that basic training that you're already providing your staff. Software purchases, infrastructure costs are not allowed. Infrastructure is the basic physical and organizational structures needed for an agency or business. When you think of infrastructure for online, think of platforms, cost to acquire, construct, reconstruct, improve, plan, So like putting in an LMS, like a learning management system, that infrastructure, that building of that thing is not included. Individual memberships and subscriptions. These are typically not allowed because the content is typically more general in nature. And so, part of that could be stuff that you're already supplying for your folks, or it would be supplanting at that point. Can't pay for high school equivalency, political related activities, outreach and promotional items, because we can't market Medicaid. So we have to be really careful about marketing and putting stuff out there with that information. Of course, gifts, incentives, bonus costs, ceremony related items, any travel, any food and beverages, fundraising, gift cards, and any lodging. So obviously this isn't an inclusive list, but we thought this would be a great way to start kind of pointing out the things that don't work. And so if there's something in this that you're a little on the fence about, you're welcome to reach out to our email and just inquire deeper and see if there's anything that we can provide in terms of feedback in that way. So due dates and award announcements. This is also on the website that Jennifer was sharing. It has the application due date. It's open for 2 months at a time, and it also has the award announcement dates. So on that page, you'll see a table with the different dates and the award dates and when you'll be notified. So good idea to just go ahead and bookmark that page to continue going back to it, not only for the frequently asked questions, but for updates on the awards and announcements. We like to ask folks to ask questions early on, give us time to answer, because we are the government, and so it does take time for us to get those questions to the right clearance level, I guess, essentially. So to ensure we're providing the most accurate and up-to-date information, it can take up to a week to get your question answered. So if the due date is looming, make sure that you're getting us those questions as soon as you know them, so we can hopefully have it answered for you by the time your application is complete. We have several informational webinars that can be found on our website. We've had 2 already, and that is different than this because we actually have the folks that are running the grant there to answer questions. And so this is definitely more of a how-to, where those informational webinars are much more conversational, and you can ask questions in those and get feedback in real time. The other 2 webinars that we've done are posted online on the website, along with the frequently asked questions, and we should have more coming up, and you can always find those on the Stakeholder Engagement ARPA calendar. This one was on there. They come out in John Barry's emails if you're signed up for those. So we'll continue to have those informational webinars every month or 2. All right, let's jump into the application. So this will actually pull screenshots from the application as you see it. So this is the Smartsheet application, and some of this is really basic, but again, we just want to give you kind of some technical assistance on walking through the application and what's expected. So this one's super simple. The date, there's a little calendar in there. You can type it in, or you can click on the calendar to select today's date. Super simple. Your provider and your company name and your provider type. The provider type is, you can just type it all. So if you're doing several different things, you're able to provide, there's not a text limit on that box. The application continued. Your demographics, and those are drop down. That's going to be a drop down menu that you can select more than one of your demographics. Medicaid provider ID, name and role of the person completing the application. Financial authority is essentially the person you're putting in that can make financial decisions for your agency. So if that's you, if you're filling this out and that's you, that is perfect. Otherwise, we ask for a name or someone that can give financial authority because they're doing the budget and stuff like that. So someone who can make financial decisions for your company. Your phone number, your email, and then the county where service is delivered. And again, you can select more than one county. The application continued. So your organization mission and or vision statement, that's a simple copy and paste if you have that handy. We like that. And then the HCBS waiver population served. Again, it's a drop-down menu. You can select as many as you'd like, as many of the waivers that you're working with. That allows us to get an idea of who you'll be serving with this training, and also goes into your scorecard, which is great. So make sure you're capturing all the waivers that you're working with. And then number of HCBS members served. So that information there in that last box. All right. So beyond the basics, so beyond just the fill in the blank. title of the requested training that you have. So if you know it, be specific. If you're like, hey, I found this training, I have this trainer, this is the name of it, put that in there for us. If the training title hasn't been determined yet, tell us why. Tell us why it hasn't been determined or you haven't found it quite yet, but this is what you're looking for. We're going to give you, it says brief training description. We get real wordy in the next couple of these slides, so bear with us. These are just examples, but certainly this will hopefully give you a little bit better of an idea of the kind of information we're looking for. So in the next couple of slides, we're going to go through some examples for you. So this one, example one, is if you know the name of your training. So how to make and preserve apple cider, easy peasy. Example two is if you don't know the title. So the title of the training has not yet been decided. However, the topic of the training will be how to make your own apple cider and preserve it for safe storage. So just tell us, if you don't know it, tell us what you want it to be about. Tell us what you're looking for, what you've identified that you need. In order to ensure fairness, because we are talking about apple cider here, our examples are going to demonstrate answers to the questions not related to any of the training or the clients or the customers you're going to be serving. We want to make sure that everyone has the ability to request what works specifically for them, and we don't want to give you language that we expect you to be using. So all of our examples today, while they hit all the points we're looking for, are not necessarily to be mirrored in your application because we're going to be talking about reindeers and apple cider. So it's just completely unrelated. So we just want to give you examples, give you some technical assistance. And so hopefully this will be helpful in terms of the information we're looking for. All right. So example for brief training description. So describe how this training will impact your HCBS waiver recipients. So for this one, they are saying, and I'm not going to read them all to you, but I'm going to read this one to you. We want to have our staff trained to safely make apple cider for our reindeer. As reindeer age, they find it harder to chew apples, so apple cider becomes the safest way for them to get their preferred amount of apple intake. The cost of buying apple cider is causing a financial hardship for the reindeer on their limited income, and the preservatives in store-bought apple cider can have negative impacts on their health. Having all staff trained on how to make apple cider will allow for it to be readily available for reindeer and reduce the financial burden they experience. It can also lead to better health outcomes. So I think we can all see kind of how this is a brief training description, but what they've done is they've described the what, the why, and the how. And so think of your, what is that? In like middle school English where we did our 5 W's, the what, the why, the how, there was an H in there too, but that's what you're thinking. You're trying to briefly describe it. And then we'll dig into the specifics as we go further here. Again, not going to read this to you, but this is the expected outcomes. Describe the training objective, expected outcomes, and how you evaluate the effectiveness of this training. What we're asking here, one way to look at it is using the SMART method. And some of us have used that before and some of us have not. But what we're looking for is for you to describe your expected outcomes by using the SMART method, which is specific, is measurable. Sorry, I'm trying to find my A's and my R's here. Attainable, relevant, and timely. And so this example, I'll go back to the first one here. This example is saying, hey, this is what we want. This is how we're going to quantify it. This is how we're going to measure it. And this is how we're going to define our expected outcomes. This is for your outcomes and not necessarily the process. We'll talk about the process a little bit later. So this is what you're hoping to accomplish by providing this training to your staff. Objectives should identify the target audience and or the community being serviced. So they need to be capable of being accomplished within the grant period as well. So you're talking a little bit about timelines there. So I'm going to pause for 30 seconds and let you read through this, if you'd like, just about how they are incorporating at least the specific and the measurable, and then we'll go on to the rest of them on the next slide. Okay, perfect. So just to, as a follow-up on this, specific, we're asking, it says who's going to get the training and who's going to benefit from it. So who are you training? Who are you serving? And the measurable is going to be explains how the effectiveness will be measured. On the next slide, we talk about the art of the SMART, the attainable, the relevant, and the timely. So again, this is just the same question. It's just additional information through that SMART method. Again, you don't have to use the SMART method. It's just something that we find hits all the boxes that we are looking for in terms of what we're looking for expected outcomes. So attainable spells out exactly how it will be completed. Realistic and relevant explains why we're doing this training, why it's relevant to the staff and to those individuals being served. And timely is how it will occur in the timeline created for the grant. How will this wrap up before the end of the grant period? So again, I'm going to give just a few minutes to read through this. All right, and we're going to go on to the final slide. And this is the last slide for expected outcomes. So we've wrapped up our SMART, and then we're talking about specifically the last two questions. So how is this going to be used once this training is completed? And what are the next steps after the training is completed? So we're really looking at that outcome piece of this. So the training's done. Now what? We spend a lot of time focusing on what the training is and how it's going to be delivered, and not so much what the outcomes are. So how is this going to help? How is this going to be something beneficial to you and your staff and time well spent? If you're wondering, this was spelled out in about 400 words. It felt like many, many more, but it's about 400 words. Feel free to use as much or as little as you need. Feel free to use the SMART or not. It's up to you. But we just wanted to give an example about reindeer and apple cider, about how this information can be conveyed, and what information we need to be able to make decisions. I'm going to give just a few minutes to read through this part. All right. And again, this is being recorded. We're going to get it posted to the website, hopefully before holiday break. So you can come back and you can read this as many times as you would like. All right, training communications. Description of how this training will be promoted to eligible participants within your organization, which is essentially, how are you going to let your staff know about this? How are you going to let people know that this is being offered? Is there a plan to get the word out? Are you going to make it mandatory? All that information can be included in this box. So in this specific example, at staff meetings, staff will be informed of the mandatory training, why it's important, and how this training will benefit both them and the reindeer. A flyer will be posted at each location to inform staff of the different sessions, and staff will be allowed to rank their preferred dates of training. Staff will be asked to take the training on their days off to lessen the disruption of reindeer care. Thank goodness. So this is just an idea of what you're doing to get the word out and how you're letting folks know that it's going to be available. Number, train, and dates of training. Again, there's a drop down for the numbers. The 26 through 50 is what's been selected on here. If you're unsure, just provide an approximate number for us, just a ballpark. It'll give you a couple different options above and below the 26 to 50. The dates can be specific, but if you don't know the dates yet specifically, just give us, again, a ballpark. So this one says the specific dates are not solidified, but will be in March, April, May, and June of 2023. Just a gentle reminder to make sure they're within the grant timeframe and make sense with when the awards will be announced. So for this first grant cycle, I believe award announcements will be announced mid-December. So don't make your dates of training December 1st because chances are you're not going to have, you're not going to have an answer whether or not the training has been awarded to you until after that date. So make sure it makes sense for when the application rolling dates and award dates are for these grant cycles. Training experience and history. Description of your organization's previous experience with training for employees and are developing and implementing training for new employees. So this can be in a couple different ways. So we provided a couple examples here. So the first one is that our training department has been developing and conducting training for over 10 years. This is something we do in-house, for example. The training manager completes train the trainer courses as often as possible. When necessary, we outsource training when internal expertise is not available. So that's an option for a lot of folks. Example 2 is we're a small agency. Our managers conduct agency-specific trainings, and we use an online training company for most initial and annual training needs. And so this is, who do you have in-house to provide the training? And if you don't have someone in-house to provide the training, how are you going to outsource it? How are you going to get the expertise that you need? If your agency is in the midst of developing the training, then this area will need to explain the credentials and expertise in developing the training. So if you're developing the training yourself, you need to say, you know, what not ability, but what experience you have in developing this specific training and why. Training delivery, how this training is going to be delivered, in person, virtual, etc. Please also include a description of the training company and organization if you're using one. If you're using an outside training company, describe why they're the best fit for this, and feel free to link their website. We'd love to be able to look into that more deeply. More information, the better, I think. And if you're not using, I mean, how are people taking the training? If it's in person, virtual, etc., please include the specifics of the location if it's pertinent. So if you have to rent a meeting room, let us know in this training delivery box here that you're going to need to ask for some money to rent a meeting room, or the meeting room you need is only available in March 2023. Any pertinent details about training delivery would be great to put in here. If it's online training, it's really important for us to know too, if you have a bank of computers there at your organization that staff can go in and use, or if they need to use their own personal devices, if they need Wi-Fi, that kind of thing, just to show that you have looked at this from an accessibility lens and that everybody in your organization is going to be able to take it in this specific mode of delivery. Timeline. This can get a little wordy, much like the other ones, but I'm going to do my best to just kind of wrap it up for us in a nice, neat little box. So provide an estimated timeline of the training, including elements such as planning, development, implementation, and evaluation. So you're probably in the planning stages right now, so you can start your narrative at that point. So what's the plan? How will it be implemented? How will you evaluate? If you're developing the training, a good chunk of this place here needs to speak to how long it's going to take you to develop that training. So Apple Cider Inc. will be able to complete the trainings in the months we've selected, which in the previous question, they said March, April, June of 2023, March, April, May, June. The sessions are capped at 10 people and staff will sign up for their first, second, and third choice so we can accommodate as much as feasible. Office staff will be included in the sessions as room is available, so they can step in when needed. Staff are not available for the cider making. So again, it's talking about folks are going to be in this training. How are we going to cover things that are outside of it? The cost for all of the apple cider supplies are included in the training fee, and the staff will take the training on their days off to ensure reindeer care is not disrupted. So again, it's a little, we understand that some of these questions are a little duplicative, that we're asking kind of the same thing in different ways. That has been pointed out to us. That will be changed in future grant applications. This was our first one. We're learning as we're going. We're just trying to get the right information, but we figured out as we pushed this application out that a lot of our questions are asking kind of the same thing. So if there's a question in your mind is like, well, I just said this, you probably did. But if you wouldn't mind, you know, just kind of reiterating it, that would be super helpful for us. So this was a long one. It's over 3 slides. I'm not going to read all 3 slides to you. But so you want to talk a little bit about where the cost is needing to be covered and that the plan for the room, I think that's the wrong slide. That's the wrong note for this slide. So anyways, as you're talking about your timeline, just continue to talk about the amount of time you're going to take, how you're going to get all the people in each session. Again, this one said it was capped at 10 people. So just talk about the ways in which this information is going to be disseminated, and folks are going to have all opportunities and accessibility to attend, especially if you're making it mandatory. You want to talk about how you're going to get everyone in. The most important part on the last piece is the implementation and evaluation part. So you've talked about your planning, you've talked about your development if you're developing it in-house, and how you're going to get everyone into the training. But then we also want to know about how you're evaluating it. How are you going to know that it worked? Are you going to ask folks to fill out a survey? Are you going to ask HCBS providers or recipients to tell you, you know, I noticed that you did this training? How are you going to evaluate it? That's probably not the best example, but you know what I mean. How are you going to evaluate it for folks to know that it was worth your while, especially in the beginning when you start giving this in March 2023? How are you going to know that what you're doing is going to work and be worthwhile for the folks taking it in June? So you might be able to implement some feedback and things like that. Let's see here. Let me go to the next slide. And it looks like Sam is just dropping all kinds of information into the chat. So thank you, Sam. So HCBS members served, continuing in the application. How will this training impact HCBS members? So how will this impact those that you serve? Will it be a higher level training that will allow for more members to be served? Will the training allow for staff to work with a larger population of members? Will this training give staff more skills that will lead to their growth? Will this lead to staff retention? What are you hoping for in terms of your HCBS members? You know, again, higher capacity, more skilled workers, that kind of thing. And again, this is one of those that's a bit duplicative of the brief training description, and will be remedied in the next grant cycle. So just know that we know that, and we're working on, especially if you apply for this grant cycle, you end the grant and you apply for another grant cycle, know that the application will look a little bit different. So you're talking about the health and well-being of reindeer is very important to our agency. And this training will allow for reindeer to have fresh apple cider at reduced costs, which will free up their funds for other necessities. The improved quality can contribute to much better health outcomes for the reindeer, and it is likely that staff turnover will be reduced due to happier and healthier reindeer. So just give us an idea of how you think this is going to help the HCBS members that you serve. Additional funding, whether or not you, your company or your organization plan on utilizing additional grant funding for this training project. For this training project specifically, we don't need you to list out all of your grants that you apply for and receive. It's just specific to this grant funding or this training project that you're applying for. If it's no, please just put an NA in there for us so we know it was, you know, you answered it, you just didn't miss it on the application. So at the bottom of the application, you'll find the file upload piece. And it'll remind you the things that we're looking for in terms of a file upload. But before I show you the upload piece, we're going to go and take a peek at the budget request worksheet as part of the application as well. So these pictures are a little blurry, but I'll do my best to explain them for you. So once you click on the, let me go back real fast for you. So this purple right here, the docs.google.com spreadsheets, that's the link to the budget request spreadsheet. So if you click on that, it's going to bring you to this Google Doc here. And what we're asking you to do is to download it as an Excel sheet. And that's what that is. This yellow here is file, download as a Microsoft Excel. That will allow you to edit it on your computer without putting your information into this Google Doc, because everybody that clicks on that link is going to have access to this Google Doc. So if you start putting your budget stuff in this Google Doc, it's going to be there for the next person that clicks on the link. So we're asking you to download it, and you can use Excel or you can use Open Document if you don't have Excel on your computer. That'll allow you to edit it. Either one of those will. And so this is the first tab. The person responsible for completing this application should be the person listed on the sheet. And so this would be the person that we reach out to if there's any questions on the application or the, well, on the budget specifically. So if you filled out the application, but you're not necessarily the fiscal agent for your agency and you want the fiscal agent to fill out this piece for you, have them put their name here. Have them be Helen Jones in that prepare name and prepare phone now. So if we have questions about the budget specifically, we can reach out to Helen in this example. And so you're going to see two different line items, training cost and training materials. Training cost and training materials cost. You may not have both of those, but we do provide instructions on here on how to fill it out. And this is really small. So know that this is the first line, the training cost. We're asking that you don't really include much for calendar year 2022, understanding that it is on the budget. But by the time we award these in mid-December, we're not looking much of calendar year 2022 left. So certainly, if you have a reason to put something in 2022, that's fine. But we certainly understand if everything is 2023 moving forward. And so what we're doing is you're putting the total cost in here, but over here in the narrative and the description is you're giving us how you got to this. It's like you're showing your work in math when you were in like high school. So the apple cider trading is $2,500 per session for 4 sessions. So that's where you get the 10,000. And then you're breaking it out for the wages for the staff to attend, 10 staff by 4 staff by 4 hours. And then different staff make different amounts. So then you're doing 6 staff for $17 an hour, et cetera. Regardless, you're getting $2,180. So you're adding the $2,180 to the 10,000, and that's where you're going to get the training cost right here. This is the amount that you are asking for as part of your application. And again, there's instructions here. If you have questions, please reach out to that email, our HCBS Direct Care Workforce team. And then the training materials cost. This is like the actual materials, not necessarily the staff cost. This one is an example of manuals. And so you're getting everyone a manual on cider making, and those are $26 a piece. So that's where your 1040 is coming from for fiscal year 2023 for your training cost, materials cost there. So hopefully that is helpful. Refer to the ineligible activities list when you're completing this to make sure you're not including those. Like for example, I can't include $20 gift cards for each staff for taking the training. And that's listed on that frequently asked questions and eligible funding thing. So just keep in mind, you might want to incentivize it in some way, but that may not be something that we can have you apply for as part of this grant. All right, so once you've downloaded and completed your budget request worksheet, you can come back to the application and do a file upload. So we're asking you to upload your completed budget request in either that Excel or open document, whichever you used. Upload your cover letter signed by the executive director or an authorizing official. And that's just so we know, you're on letterhead. It's a cover letter signed by your director, basically saying like, we know you're doing this and you're not just all willy-nilly making applications. A W-9 form and a certificate of good standing from the Secretary of State, if applicable. And then you're also welcome to upload any other items related to this grant application that you find might be helpful. If you have a copy of the apple cider workbook that you think would be helpful in us making a decision, feel free to upload that. And you can drag and drop your files or browse files and upload them from your computer. Let me see. Should you have any issue with the dragging and dropping, just email the documents to us. We can match the provider name. You'll get a confirmation email when your application and all the documents have been received. We'll also reach out if we seem to be missing something. That'll all come from that HCBS_Direct Care Workforce email address. So for example, you might have requested a specific training. We might ask you for more information on that training if it wasn't found in your application. If we're looking for an outline or something like that, just make sure that the information and the contacts you're putting on your application are available for questions, and know that we would be reaching out from that HCBS_Direct Care Workforce email just to shore up any questions we might have to be able to fully evaluate. All right, that was quick. Actually, no, it was 40 minutes. You have been listening to me talk for 40 minutes. Thank you very much. Again, this is just our email address for any questions you have about the grant before you apply, during your application, and then you can expect to hear from us from that after you submit your application as well, just to let you know we received it or if we need any more information. I appreciate you being patient with Jennifer and Sam and I today. I literally was just reading off the slides that were given to me. So know that we appreciate you doing this walkthrough with us. And if you have any questions, please reach out to the team at that email address. All right. That's my thank you. So I'm going to go back to the email just to make sure everybody has it. Sam, maybe we can do one final drop in the chat of the 1.05 grant website and our email address, just so folks don't have to scroll back up. And then I think I will go ahead and stop the recording.